gram-negative Coccobacillus, which belongs to a family of bacteria called the Enterobacteriaceae. It causes a disease called plague, which is transmitted by rodents, mainly rats, as well as prairie dogs and their fleas. Plague is highly contagious, and there have been 3 major pandemics in human history. One of them, known as the Black Death, killed up to 1/3 of the European population. Yikes. Now, Yersinia pestis has a thin peptidoglycan layer, so it doesn't retain the crystal violet dye during gram staining. Instead, like any other gram-negative bacteria, it stains pink with safranine dye. On Wright Giemsa and Wason staining, it has a bipolar staining, which means that only the poles of the bacteria stain, and the rest of it remains unstained. So the bacteria look like safety pins under the microscope. Alright, now Yersinia pestis is non-motile, non-spore-forming, facultative anaerobic, which means that it can survive in both aerobic and anaerobic environments, and facultative intracellular, which means it can survive both inside and outside the cells. It's oxidase and urease negative, which means it doesn't produce these enzymes, and catalase positive, which means it produces an enzyme called catalase. Also, it's indole negative, which means it doesn't convert tryptophan into indole. Yersinia pestis grows well on MacConkey agar, sheep blood agar, and chocolate agar. MacConkey agar is used to identify if a bacteria ferments lactose or not, and it contains a pH-sensitive dye in lactose. So if a bacteria ferments lactose, it means that it produces acid, which causes the pH-sensitive dye to turn pink, leading to the formation of pink colonies. Non-lactose fermenters, like Yersinia pestis, are not able to modify the pH-sensitive dye, and grow into colorless colonies. Next, on sheep blood agar and chocolate agar, Yersinia pestis forms opaque, yellow colonies that look like fried eggs. Finally, the triple sugar iron test, or TSI for short, can be done to assess hydrogen sulfide production. This medium contains 3 sugars, lactose, glucose, and sucrose, as well as iron and a pH-sensitive dye. If the bacteria produces hydrogen sulfide, that reacts with the iron, and a black precipitate forms in the test tube. Yersinia pestis does not, so no precipitate forms. Now, the pathogenesis of Yersinia pestis consists of 2 components: the transmission of bacteria from fleas and the host response to the bacteria. First, fleas get infected with Yersinia pestis by feeding on a bacteremic host like rats, which then colonizes the flea midgut. So when the flea bites a human, it regurgitates the bacteria into the bite wound. Once the bacteria gets inside the host, neutrophils and macrophages come to the wound site to kill the bacteria. Now, the bacteria has a capsule, which consists of a capsular antigen called F1 and antiphagocytic properties. But inside the flea gut, it loses the capsule, so neutrophils can easily destroy the bacteria. Sadly, macrophages are not as efficient in killing the bacteria, so if the bacteria is caught by macrophages, it can survive inside them and get carried to the lymph nodes where it replicates and causes lymphadenopathy. Inside macrophages, it starts to use virulence factors to avoid destruction. So now it starts again to produce its capsular antigen F1. Also, it has a type 3 secretion system, or T3SS for short, which is a collection of proteins that can dampen the immune response. So using T3SS, it starts to inject inside the macrophage Yersinia outer proteins, or YOPs for short, which block secretion of pro-inflammatory cytokines like TNF-alpha and IL-8, and inactivate the macrophages, leading to evasion of phagocytosis. Additionally, it produces a siderophore, called Yersinia bactin, which goes on a hunt for iron, and when it captures it, returns to the bacteria. Iron acquisition is an important step for Yersinia in order to thrive and replicate. Finally, the macrophages burst, allowing the bacteria to spread throughout the body, and cause 3 different forms of the disease: bubonic, septicemic, and pneumonic. Bubonic plague develops when Yersinia pestis spreads to nearby cells in the lymph nodes, making the lymph nodes swell. These swollen lymph nodes are called buboes, hence bubonic plague. From the lymph nodes, it can get into the bloodstream, causing septicemic plague. And remember that the bacteria now has its capsular antigen F1 again, so circulating neutrophils cannot destroy them anymore. Once in the bloodstream, Yersinia pestis secretes endotoxins, which leads to an excessive production of thrombin, which creates a procoagulant status inside blood vessels, leading to disseminated intravascular coagulation, or DIC. With DIC, tiny clots form throughout the body, cutting off blood flow in different regions, causing tissue necrosis. The bacteria can travel to any part of the body, which can cause multi-organ failure. If left untreated, septicemic plague can progress to overwhelming sepsis and death. Finally, pneumonic plague develops one of two ways. One way is when bacteria spread to the lungs from the bloodstream, in which case it's called secondary pneumonic plague. Now, when humans with secondary pneumonic plague cough or sneeze, they release respiratory droplets that can cause primary pneumonic plague in individuals who inhale these droplets. So you can see how this can easily turn into a pandemic situation. Symptoms of bubonic plague include fever, chills, fatigue, and on a clinical examination, buboes can be seen, frequently in the inguinal or axillary region. With septicemic plague, there's hypotension, malaise, purpuric skin lesions, and tissue necrosis, which appear as black regions on the limb. Finally, with pneumonic plague, there's dyspnea, fever, chest pain, cough, and hemoptysis, which is blood in the sputum. Plague can be diagnosed by isolating Yersinia pestis in cultures from blood, buboaspirate, and sputum, and also identifying the bacteria in a peripheral blood smear using Gram, right Giemsa, or Wason staining. Also, a fourfold increase in antibody titer between serum probes obtained at least 2 weeks apart, done using serological tests, can confirm the diagnosis.
Now, there's also a rapid antigen test that can be done to identify Yersinia pestis F1 antigen in the sputum or serum within 15 minutes.
Finally, a chest x-ray might reveal signs of pneumonic plague, like consolidation, which appear as white areas, or cavities, which can appear as walled-off, lucent areas within the lung. Plague can be treated with antibiotics, usually aminoglycosides like gentamicin and streptomycin. Other antibiotics that can be used are doxycycline, tetracycline, fluoroquinolones, and chloramphenicol. The usual duration of the treatment is 10 to 14 days. Alright, as a quick recap. Yersinia pestis is a gram-negative bacillus that grows well on blood, chocolate, and McConkey agar. Its virulence factors include capsular antigen F1, which protects it from neutrophils, and YOPS, which inactivate macrophages, as well as a siderophore, which it uses for iron uptake. It produces a disease called plague, which has 3 forms: bubonic, septicemic, and pneumonic. Plague is diagnosed by identifying the bacteria in cultures from blood, buboaspirate and sputum, or in a peripheral blood smear with Gram, right Giemsa, or Wason staining, and also through serological tests and rapid antigen tests. Finally, it's treated with aminoglycosides like gentamicin and streptomycin for a period of 10 to 14 days.